What's up, dear students? Today we're gonna be talking about cardiac cycle, the period of time that begins with contraction of the atria and ends with ventricular relaxation is known as the cardiac cycle. The period of contraction that the heart undergoes while it pumps blood into circulation is called systole. The period of relaxation that occurs as the chamber filled with blood is called diastole. Both the atria and ventricles undergo systole and diastole. And it's essential that these components be carefully regulated and coordinated to ensure blood is pumped efficiently to the body. The cardiac cycle begins with atrial systole and progresses to ventricular systole, atrial diastole and ventricular diastole. When the cycle begins again, correlation to the ECG are highlighted. Pressures and flow. Fluids, whether gases or liquids, are materials that flow according to pressure gradients that they move from regions that are higher in pressure to regions that are lower in pressure. Accordingly, when the heart chambers are relaxed diastole, blood will flow into the atria from the veins, which are higher in pressure. As blood flows into the atria, the pressure will rise, so the blood will initially move passively from the atria into the ventricles. When the action potential triggers the muscles in the atria to contract, atrial systole, the pressure within the atria rises further, pumping blood into the ventricles. During ventricular systole, pressure rises in the ventricles, pumping blood into the pulmonary trunk from the right ventricle and into the aorta from the left ventricle. Again, as you consider this flow and relate it to the conduction pathway, the elegance of the system should become apparent. Phases of the cardiac cycle. At the beginning of the cardiac cycle, both the atria and ventricles are relaxed, diastole. Blood is flowing into the right atrium from the superior and inferior vena cava and the coronary sinus. Blood flows into the left atrium from the four pulmonary veins. The two atrioventricular valves, the tricuspid and mitral valves, are both open, so blood flows unimpeded from the atria and into the ventricles. Approximately 70 to 80% of ventricular filling occurs by this method. The two semilunar valves, the pulmonary and aortic valves, are closed, preventing backflow of blood into the right and left ventricles from the pulmonary trunk on the right and the aorta on the left. Atrial systole and diastole. Contraction of the atria follows depolarization, represented by the P wave of the ECG. As the atrial muscles contract from the superior portion of the atria toward the atrioventricular septum, pressure rises within the atria and blood is pumped into the ventricles through the open atrioventricular, tricuspid and mitral or bicuspid valves. At the start of atrial systole, the ventricles are normally filled with approximately 70 to 80% of their capacity due to inflow during diastole. Atrial contraction, also referred to as the atrial kick, contributes the remaining 20 to 30% of filling. Atrial systole lasts approximately 100 milliseconds and ends prior to ventricular systole, and the atrial muscle returns to diastole. Ventricular systole. Ventricular systole follows the depolarization of the ventricles and is represented by the QRS complex in the ECG. It may be conveniently divided into two phases lasting a total of 270 milliseconds. At the end of atrial systole and just prior to atrial contraction, the ventricles contain approximately 130 milliliters blood in a resting adult in a standing position. This volume is known as the end diastolic volume, EDV, or preload. Initially, as the muscles in the ventricle contract, the pressure of the blood within the chamber rises, but it's not yet high enough to open the semilunar pulmonary and aortic valves and be ejected from the heart. However, blood pressure quickly rises above that of the atria that are now relaxed and in diastole. This increase in pressure causes blood to flow back toward the atria, closing the tricuspid and mitral valves. Since blood is not being ejected from the ventricles at this early stage, the volume of blood within the chamber remains constant. Consequently, this initial phase of ventricular systole is known as isovolumic contraction, also called isovolumetric contraction. In the second phase of ventricular systole, the ventricular ejection phase, the contraction of the ventricular muscle has raised the pressure within the ventricle to the point that's greater than the pressure in the pulmonary trunk and the aorta. Blood is pumped from the heart, pushing open the pulmonary and aortic semilunar valves. Pressure generated by the left ventricle will be appreciably greater than the pressure generated by the right ventricle, since the existing pressure in the aorta will be so much higher. Nevertheless, both ventricles pump the same amount of blood. This quantity is referred to as stroke volume. Stroke volume will normally be in the range of 70 to 80 milliliters. Since ventricular systole began with an EDV of approximately 130 milliliters of blood, this means that there is still 50-60 milliliters of blood remaining in the ventricle following contraction. This volume of blood is known as the end systolic volume. Ventricular relaxation or diastole follows repolarization of the ventricles and is represented by the T wave of the ECG. It too is divided into two distinct phases and lasts approximately 430 milliseconds. During the early phase of ventricular diastole, as the ventricular muscle relaxes, pressure on the remaining blood within the ventricle begins to fall. When pressure within the ventricles drops below pressure in both the pulmonary trunk and aorta, blood flows back toward the heart, producing the dicrotic notch seen in blood pressure tracing. The semilunar valves close to prevent backflow into the heart. Since the atrioventricular valves remain closed at this point, there is no change in the volume of blood in the ventricle. So, the early phase of ventricular diastole is called the isovolumic ventricular relaxation phase, also called isovolumetric ventricular relaxation phase. In the second phase of ventricular diastole, called late ventricular diastole, as the ventricular muscle relaxes, pressure on the blood within the ventricles drops even further. Eventually, it drops below the pressure in the atria. When this occurs, blood flows from the atria into the ventricles, pushing open the tricuspid and mitral valves. As pressure drops within the ventricles, blood flows from the major veins into the relaxed atria and from there into the ventricles. Both chambers are in diastole. The atrioventricular valves are open and the semilunar valves remain closed. The cardiac cycle is complete. That's it, dear students. Please subscribe to my channel. Put your comments on comment section. Give me your likes. Goodbye. See you.